I've always been interested in service and trying to find opportunities to give back to the community, especially wanting to be a physician in the future. I've always thought, I want to know the needs of the community so that I can better serve them. And I felt that HPHC was the perfect platform to do that.
For me, I was really drawn to HPHC because I know I needed research for residency applications, but I wanted to do something that was just kind of mentally stimulating in another way. And I had done a lot of service in undergrad. And so the first time I heard about it, I was like, oh, this sounds right up my alley. It's like the perfect combination of both research opportunities and still interacting with the community. So it was a no-brainer for me.
I think there are some folks who think like, oh, students really just care about like the biology and these different more clinical components of medical education. And I feel like that they think students are not as interested in these other topics. But this has just shown me that our students are just hungry for the opportunity to learn more. And so how can we develop that? Also, to really be excited about what's coming down the pipeline with our future physicians. The students during the summer go on several experiential learning trips and service opportunities. And then every Friday we have seminars discussing relevant public health topics that students don't get as much exposure to within their standard medical school curriculum.
Social issues, social justice, environmental health, queer health, just like all these different topics that you maybe touch on for half an hour, but I think a lot of us want more of that. I think a lot of us who do AmeriCorps, and I think a lot of people who go into medicine in general, you do it because you feel kind of a connection with your community. So that's exactly what seminar was, and it's opportunities to really engage with your classmates in those discussions and really help develop each other's skills and become better physicians for it.
It was a lot more of a learning opportunity than I expected. At first I thought it was going to be more of like a discussion-based thing, but it was more of a combination of learning and then discussing what you just learned. There was just so many different topics that I didn't even maybe realize were problems that needed to be addressed in our community, and I think the seminars did a really good job at informing and also empowering the students to take action in those issues.
With each week, I felt a little more confident going into those appointments because now I'm getting education about trauma-informed care. I'm getting education about more marginalized communities, their needs, how to be an advocate, what does social justice work look like in healthcare. And then being able to apply it was very helpful.
I think the cohort experience, from what I've heard from our students who have gone through the program, is it helps them to develop connections across the campuses, but even within their own. And so it's really about developing these close relationships. And students' wellness is often a topic we discuss within medical education, but one thing that we can do to kind of build resilience and build opportunities for student wellness is helping them to develop those close relationships with each other.
I absolutely loved it. I feel like I knew one person coming into this. I was a little nervous, like, oh no, these people are from other campuses. Like, I haven't met any of them. What are they going to be like? But even just that first day, it was having real conversations, and all of these people are really motivated. Getting to talk with them, interact with them. I built some friendships that I know will last way past med school.
I think that our students really bring a level of deeply understanding the community more, but also having that cultural humility and that intellectual curiosity to want to learn more. I think they also understand how much these social issues and social determinants of health, honestly, are just interconnected. I know that they're going to be the type of physician that people need who are going through trauma or who have experienced traumatic events. I think that our students are able to build trusting relationships with their patients and to be able to take their time to really assess what is necessary.
Long term, HPHC has really kind of opened my eyes to how I want my career to look. And after doing this work this summer, along with my scholarly concentration in public health that I was doing, I really kind of realized I have a real passion for doing this work, and it's something that kind of gives me a lot of energy. And so I think, that impact is going to carry out the rest of my career.
Easily. Let me sign up for year 2. Give me another stipend, and I'm in. No, I'm in.
Absolutely. I would do this every summer or even like longer than the summer as long as I had the time to do it.
100%. I wish I could. I wish there was another summer, another gap. And I have full intentions of carrying forward what I've learned, but also my relationship with Exodus and the trainings that we've done into the future work that I do.
I wouldn't do it next summer if I had another free summer. Like, that's not even a question.
I would, yes, 100%. Yeah, it was. I mean, like I said, it was an invaluable experience, and I don't think it's something I could have gotten anywhere else. So,
Not only this experience alone, but also what this experience has led to, it reshaped the way I approach my education and the way I want to learn to treat my patients in the future.